Bonjour, I'm Michelle Peterson, the Green candidate for Orléans. Merci de prendre le temps de visionner cette vidéo et merci à l'Association nationale des retraités fédéraux de m'offrir l'occasion de m'adresser à vous. I'd first like to tell you a bit about myself. I grew up in Orleans. I've dedicated my career to social services. I began my career in youth mental health promotion and suicide prevention. And the last 12 years, I have worked in gender-based violence. My experience as a Franco-Ontarienne, a single mom, and someone who has dedicated their career to social services has led me to understand the cracks in the system, and especially those revealed during the pandemic. I'm happy to have the chance to talk to you about what the Greens would like to do for older adults. When it comes to senior healthcare, we absolutely need to expand capacity in our hospital system to address the surgical backlog and hallway medicine that existed prior to COVID. Of course, COVID certainly made it much worse. One way to do this is to make sure we have enough staff and physical space to meet our healthcare needs, but also addressing things like home care is vitally important. We all need to mandate a minimum standard of 4 hours of care each and every day for each resident. And implementing that now, not waiting 4 years like our current government. And on top of that, I think we need to prioritize people in care over profits and phase out for-profit long-term care homes. That's where we saw most of the outbreaks and sadly most of the deaths. Our tax dollars should be prioritizing care for people and not the size of shareholder returns. When it comes to home and community care, I'm a strong believer in investing more public funds delivered to home and community care, and also looking at best practices around living arrangements such as co-housing. You can see co-housing for seniors in a number of countries around the world. Older adults can live independently and be active and valued members of our community. We also need to hire more staff and make sure that those people receive fair wages, guaranteed full-time work with benefits, because we know that the quality of care is directly related to the quality of people caring for our loved ones. Our vision is for an Ontario that cares for its people and the planet we live on. When it comes to age-positive well-being, of course, coming from a social services background, I'm a huge advocate for by and for approaches. And Greens support this approach, especially when it comes to groups who are often underrepresented and not heard. I'm thinking of Indigenous people, racialized people, Francophones, people with disabilities, and seniors, for example. I fully support and understand the need for older adults being involved in policy decisions. While there are many retirement residents in our community, for example, there are limited options for older adults who are living alone. And just recently, an older family member of mine wanted to downsize from her 3-bedroom home, but she couldn't find a suitable apartment or condo that met her needs. Sadly, she had to move to the West End and now is living further away from her family and social support system here in Orleans. So we need a new solution to these old problems, and the Green Party is offering a vision that connects the dots. We can build 15-minute communities in which people live, work, and play. And this vision includes reducing restrictions so that it is easier to build in-law suites and have older adults remain close to their families and friends. It also includes making it easier and safer to commute by bike, on foot, or by transit, allowing us to keep fit and maintain our health well for many, many years to come. In terms of income security, there are many things we want to do to make things more affordable to for Ontarians. We absolutely support the federal government bringing universal dental care and pharmacare. We would sign on to those and bring provincial financial resources to the table to make sure that they are implemented in Ontario. We'd restore the pharmacare program that the previous government had in place for individuals under 24, and also fund take-home cancer treatments as well. For pharmacare to truly work in the most effective and efficient way, we really need the federal government at the table, and we need Ontario to commit to that. It would sign onto any deal to put the necessary financial resources in place to make it happen. GIS, an Ontario guaranteed income system, is currently at $83 a month. We would absolutely increase that. Greens also want to implement a guaranteed basic income for all Ontarians. Nobody should be left behind in time of personal crisis, and a basic income would protect our most vulnerable people from ever having to live in poverty. It would also allow for family caregivers to dedicate their energy and time to the loved ones they are trying to care for, rather than to be stressed about how they're going to make ends meet at the end of the month. Again, thanks for taking the time for being with me. Merci beaucoup de prendre le temps. For the Ontario you want and the leadership we need, vote Green.